Let's talk health now. The Nigeria Center for Disease Control and Prevention has allayed fears following the outbreak of human metapneumovirus in China and other regions. Director General of the NCDC, Jide Idris, says Nigeria is at moderate risk for the virus. He also mentioned that the agency is taking proactive measures to ensure the public is informed and prepared for any potential impact of the virus. Although no case of HMPV has been reported in Nigeria, the NCDC mentions that it has ramped up surveillance efforts nationwide. Dr. Idris also says as of Monday, Nigeria's National Influenza Sentinel surveillance system has not reported any unusual increase in respiratory infections, including those caused by HMPV. The World Health Organization has clarified that there has been no emergency declaration amid growing attention to the rising circulation of respiratory viruses, particularly human metapneumovirus in China. I spoke with the Professor of Virology, Oyewale Tomori, on the news at 7 on the likely symptoms of the HMPV.
Right now, with what we are seeing, although the problems are rising in China, but remember, we had the same problem in 2020, and it ended up with what we have. So it is better to be prepared and assume that we're going to have a major problem. So that's why preparedness becomes important. And I think one should commend the government for what it's doing right now. Although this virus is quite different from COVID virus, and it's different from other respiratory viruses that we know. And it was discovered first, I think, in 2001. I think it was in Pakistan. Now we're seeing an upsurge of cases in China.
Let's now tell you more about the human metapneumovirus. HMPV symptoms can be similar to other respiratory illnesses, such as the common cold, flu, or COVID-19, making diagnosis difficult without specific testing. But here are some of the symptoms to look out for: cough, runny or stuffy nose, fever, sore throat, headache, and tiredness. In more severe cases, HMPV can cause wheezing, difficulty breathing, hoarseness, pneumonia, bronchiolitis, rapid breathing, and retractions, a visible pulling in of chest muscles. To prevent the spread of HMPV, practicing good hand hygiene is essential, including frequent hand washing with soap and water. Respiratory etiquette such as covering the mouth and nose while sneezing or coughing and wearing a mask can also limit the spread.